Good morning, my name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here with a COVID update for New South Wales for Friday the 3rd of December 2021. There were 337 cases reported in New South Wales to 8 o'clock last night. There were more than 80,000 COVID tests reported in the same period. New South Wales Health can confirm one further case of Omicron COVID variant of concern, bringing the total number of cases in New South Wales of this variant to 9. The case is a student at Regent's Park Christian School in Western Sydney. The senior school has been dismissed for the year. Contact tracing and further investigations are underway. New South Wales Health is concerned the virus may have been acquired in the community, as the case has no identified overseas travel history or links to people from overseas. There are currently 140 people with COVID in New South Wales hospitals, with 25 in intensive care, 10 of whom require ventilation. In terms of vaccination, in New South Wales now 94.6% of people 16 years and over have received one dose of vaccine, and 92.6% have been fully vaccinated. Of people aged 12 to 15 years, 81.3% have received one dose of vaccine and 76.9% are fully vaccinated. New South Wales Health's ongoing sewerage surveillance system that detects fragments of the virus that causes COVID-19 have been tested positive in 3 communities in regional New South Wales, where there are no known recent cases. These are West Wyalong, Quirindi and Bellingen. So if you've been to these communities or live in these communities in currently, then please come forward for testing. If you get even the mildest of symptoms, get tested right away with a PCR test at one of the clinics. The number of people with Omicron variant of concern in New South Wales is now 9. As announced yesterday, there was a traveller on flight SQ231 from Singapore, which landed in Sydney on Sunday, the 28th of November, who's been infected with Omicron variant of concern. They were fully vaccinated and had recently travelled in southern Africa. The person had been in hotel quarantine since arriving, as required under the New South Wales Public Health Order. New South Wales Health is requesting every person who is on the flight SQ231 from Singapore to Sydney on the 28th of November to immediately get tested for COVID-19 if they've not already had their first test, and isolate until they receive a negative result. Under the Public Health Order, they're also required to get a COVID PCR test on day 6 after arriving in New South Wales. All travellers arriving in New South Wales who have been in South Africa, Lesotho, Botswana, Zimbabwe, Mozambique, Namibia, Eswatini and Malawi during the 14-day period before their arrival in New South Wales must enter hotel quarantine for 14 days, regardless of their vaccination status. It's critical that anyone who's already arrived in New South Wales who has been in any of the 8 African countries within the 14 previous days must immediately get tested and isolate for 14 days and call New South Wales Health on 1800 943 553. All passengers must monitor for symptoms, and if any symptoms occur, please get tested again. Any passengers arriving from overseas aged 18 years and over who are not fully vaccinated need to go directly into hotel quarantine for 14 days. In this phase of the pandemic, the onus is on all of us to keep each other safe. And we strongly recommend wearing a mask while indoors and be vigilant for symptoms. Thanks very much.